this is Stephanie. I'm a Lincoln Tech instructor. Today I'm going to be talking about feeding and nutrition for a patient. So when it comes to feeding and nutrition to a patient, it's always important to know their food allergies, if they have any allergies to their food, and if they're getting the appropriate diet. So sometimes patients in long-term facilities have allergy bracelets. They should be wearing them if they have any medication allergies or even food allergies. I'd always check the chart and identify the patient, name and date of birth, to make sure who you're speaking to matches the chart and what's in the chart is accurate. Just in case dietary brings up something that's not appropriate for them, you want to catch it before the patient consumes it. So as here we have just some basic things, a little tray, we got a little plate, bowl, a glass. Depending on the patient, we need to know about their mobility. Are they able to feed themselves? If they're not able to feed themselves, then that's when we come in with our utensils and we assist the patient. Another important thing, does the patient wear glasses? Are they blind? Are they having any visual impairment? If they are able to feed themselves, we should be able to set the tray in front of them and identify location in a clock manner. 12 o'clock is your meat, 6 o'clock is your maybe vegetables or potatoes, and so on and so forth as well. You should identify where their beverages are, if it's in the front, in the back, so that you know what they're eating. It's important for you as the nurse, if you are not assisting the patient, you come back and check in on them. If they've eaten or not eaten, then you ask, why haven't they eaten? Is it something they don't like? Do we need to get something else? Was the food too hot? Was it food too cold? So all these preferences and things we need to know about this patient, because nutrition is very important, especially the vitamins, minerals in the food. And if they have wounds and wound issues, they're gonna have trouble with wound healing. So this is why nutrition is very, very vital. Now, if you have a patient that has history of stroke, and stroke can be dysphagic or dysphagia, which is trouble swallowing. So there are different types of things, and we have nutrition that can come in. We have speech swallow evals that can be done by our oral pathologist. So we have different types of things that we can do. Now, if the patient needs to have pudding thick fluids, an example of that would be like baby food. That's a thicker consistency, it's smooth, and it might be easier for them to swallow. Other things you might be familiar with is thicket, and thicket is goes into any fluids, clear fluids, that thicken the beverages depending on how many tablespoons or teaspoons you put in the cup. For example, if you want nectar thick, which is the thickest, you put in, well, according to this, it says 3.5 teaspoons. If you want honey and pudding, pudding thick is 5 teaspoons and honey is 4 to 5. So I'll show you the consistencies, the differences. This is basic water, so you can see how thin it is. See how thin the water is? It pours very, very easy in the cup. So if someone has a swallowing issue, maybe that's not appropriate for them because they could aspirate. And we've talked about this as well. Aspiration can cause maybe aspiration pneumonia, and these are things we want to avoid. This is the thickest. See how thick it is? The fluid. It's almost like, I don't know, would you say that's pudding? Mm-hmm. It's pudding thick. So that is different types. And I got one more over here. And then nectar is like thinner, but it's just slightly thicker than water. Might be easier for them to get down. So depending on recommendations by dietary or speech swallow, we can get these patients on the appropriate diet. Some of the packets, different packets facilities might have as well. This is already kind of like a gel. It's a thickened gel, and this is honey consistent. So compared to this powder, this is a gel, and you just simply squeeze it into the fluid, you mix it up, and then it makes it a little bit thicker for them. So that is honey thick, and then this is an example of nectar thick. Other things we can talk about. If the patient is bedbound versus someone who's able to get around and move, the patient should always be elevated up in the bed, especially to help with swallowing, because
that's a higher risk of aspiration. You don't want them to be lying down flat on the bed to swallow. That could be a higher risk for choking. So you always want to elevate the head of the bed for the patient to swallow. If they're able to sit up, you can sit them up straight in a chair so they can have better movement, and that will facilitate digestion better and swallowing better. As far as everything's covered. This is everything we can talk about, diet and feeding nutrition. So if you have any questions, feel free to reach out to your instructor.